It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 situation here in the nation. In just a few moments now, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. We're going to go into the briefing room where Yoon Tae-oh, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So we are going into the briefing room right now, and in just a few moments, Yoon Tae-oh, Director General, will be making his way to the podium to give us the latest number of infection cases in Korea. And it looks like the briefing is just about to begin.
Let us now begin our regular briefing for June 5th, Friday. As of today midnight, we have 39 new cases, and of them 34 are local transmissions, while 5 of them are imported cases. And as of today midnight, the total number of confirmed cases stands at 11,668. Of them, 10,506 have been discharged, and we have a total of 889 people in quarantine undergoing treatment. The fatality remains unchanged, and the death toll now stands at 273. This morning, KCDC held a meeting presided over by Prime Minister Chung Se-kyun, and we talked about diverse issues, including the psychological consultations to overcome COVID-19, as well as the latest outbreaks in the metropolitan area. Prime Minister Chung Se-kyun has said that today marks the 100th meeting of the Disaster and Safety Countermeasures Headquarters, and today also marks the 1 month since we've transitioned into our daily life quarantine, and he also thanked all of the public officials for their support and their active support. And he also says that it is not easy for us to return to the routine daily lives with balancing our quarantine measures. And he also highlighted that complacency is the biggest risk factor that we face at hand right now. And he also highlighted that distancing is the best vaccine against the virus that we have right now. And the following are some updates on the domestic infections. Out of the 39 new cases, we have 34 local transmissions, and among them, 31 are clustered in the metropolitan area. We had the Kupang Logistics Center and Itaewon Club case starting in May, and we are still seeing cluster infections, sporadic infections throughout the metropolitan region. And as of the first case of the small church of the metropolitan area, we have witnessed on the 31st of May, this number has increased to 37 as for this newly planted churches in the metropolitan area. And we also have been witnessing new cluster infections against the multi-level marketing firm in the metropolitan area as well. And we are very much concerned of the continued transmissions that are spreading throughout the communities. And up until now, the quarantine authorities are aiming to reduce the speed of infection in order to keep the condition at control. So we ask for the members of the public who are living in the metropolitan area to avoid from social gatherings and going outside during this weekend. And in particular, during the weekend, we have some words for the religious facilities. Currently, we are seeing a witness of the cluster infections in the small group meetings. So we ask you to postpone or cancel any small gatherings and switch to non-face-to-face methods. And if having an on-site service is unavoidable, you need to host the events and reduce the number of participants, and to check people for their fever and other symptoms, and require all of them to wear face masks. And please refrain from eating together and engaging in any activities that may increase the respiratory droplets travel in air. And the quarantine authorities, we have been, as we witnessed and experienced the COVID-19 outbreak, we have also revised the Infectious Disease Act in March. And yesterday, the revisions had made public and disclosed to the public as of yesterday. And in order to increase the speed of diagnosis, we also increase the doctors and the medical staff's diagnosis of the infectious disease testings. And considering the factors and nature of the infectious disease, we also had in place the disclosing of the privacy information in hand before we conduct the epidemiological investigations. And we also have provided a meaningful procedure so that these will be implemented throughout the nation, and we also increased conditions and terms to enhance the increasing of the epidemiological investigation here in the country. And when at the administrative districts with over 100,000 people, residents, we also designated and mandated a designation of the infectious disease control officer who will be in care of the epidemiological investigation at that specific region. So going forward, we will continue to act to overcome such infectious disease going forward. And following is the details on the psychological consultations for us to overcome COVID-19. And as we are experiencing a prolonged COVID-19 outbreak, many of the public are experiencing so-called Corona Blue, which is a depression that is experienced through the COVID-19. And since January, we have set up in place a hotline for the psychological consultations for any members of the public. And we also have plans, also initiatives like giving of indoor garden and plants for those who are on self-quarantine to help them adjust to the situations. And also, starting from recently, we also provided we are planning to provide a forest treatment and healing program for the people who have been feeling such depressions. And starting August, we will also provide staged the psychological consultations and treatment for the people who are experiencing high level of depression. And we are currently exerting our multifaceted efforts to help our people cope with the virus mentally. And so if you are experiencing nervousness, stress, or mental illnesses due to COVID-19, please reach out to us and please call the hotline as well as the public health centers to get support. Today marks the 100th meeting of the Disaster and Safety Countermeasures Headquarters. Up until now, after the meeting, we have been updating the public with the briefings and the press kits every day. And this meeting is currently conducted with the ministry's heads as well as the 17 heads of the local governments. And together we are also cooperating closely with about 3,000 public officials nationwide who are invited through the virtual means. And after our main headquarters meeting, these are followed by local districts meeting as well. And first, we shared the information, latest information transparently. And second, we had a very swift and immediate decision-making process. And third, we also shared this experience and decisions to the entire nation so that they could be implemented nationwide. And through this, centering around the head of the Prime Minister, we were able to exert our pan-government efforts to overcome the virus. And we had to share a concerted efforts to overcome the virus as well. In the first half of the year, as we overcame the COVID-19, this meeting is regarded as a crucial governance to respond to COVID-19. And such experience of governance is a very unique experience that Korea is experiencing right now, and it will become an invaluable asset as we address and respond respond to the outbreak. And I take this opportunity to extend my thanks to all of the people working at the central government ministries as well as local governments. So I would like to thank each and every ministries, including the Foreign Ministry, Agriculture Ministry, Interior Ministry, Transport Ministry, Welfare Ministry, Family Ministry, as well as Fire Departments and Defense Ministry and the Ministry of Veterans Affairs, as well as also the Culture Ministry, the Communications Commission, and also the related officials at the Ministry of Food and Drug Safety and Finance Ministry and Trade Ministry as well. So we have at all of these government ministries, we have public officials and at the local government level who are exerting their full efforts to support our pan-government response. Tomorrow is the 65th Memorial Day here in Korea, and it is time for us to send and remember the sacrifice of our noble heroes who fought for the nation. And up until now, there are many people, including the people who are in uniform and firefighters, as well as the military officials who are securing the country. Even when the country is at stake, many people have sacrificed their lives, and this makes today's Republic of Korea possible. And I'm sure that our future generation will remember our present as we fight against the COVID-19 outbreak. And until the next weekend, I believe that we will have strengthened quarantine measures put in place at the metropolitan area. So please be vigilant continuously, and please abide by personal hygiene measures, including hand washing, wearing a face mask, and physical distancing. And please postpone or delay your physical meetings. And please remember that your individual actions and behaviors could affect the future of the Republic of Korea, and it will be an act to protect our country and society. Thank you very much.
That was a live briefing from the South Korean health authorities you just heard there, updating us on the situation. We heard that the new number of infection cases was 39, bringing the total number of accumulated cases to 11,668. And there were no new deaths, meaning that the death toll stays still at 273. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regularly scheduled newscast at noon Korea time. Bye for now.